Hello everyone, welcome to Unacademy. Let's crack NEET PG. I'm Dr. Shilpa Dinesh. I'm a practicing pediatric consultant in Bangalore. I have an experience of teaching undergraduate and postgraduate medical students. I have done my MBBS and MD from Rajiv Gandhi University of Health Sciences. Today we'll be discussing about growth and development. As you all know, growth and development is a very important topic in pediatrics as well as for your NEET PG preparation. Since this is a very basic topic, a lot of questions can come from this chapter, and you need to know all about growth and development. So today we'll be discussing in detail uh, growth and development. But before that, I would want to talk a little about Unacademy. Unacademy is India's largest online learning platform. There are a lot of benefits you can avail from this platform. Firstly, live classes. You have daily live classes, and you can attend them every day, and you can engage with your educator and discuss your doubts, and that will be answered then and there. Secondly, for any entrance exam preparation, you need to have a structured approach. Here in Unacademy, all these courses are structured in line with your exam syllabus, and that comes of great help for your preparation. Thirdly, when you prepare for your uh, entrance exams, you need to evaluate yourself. Okay, how do you evaluate yourself? That is through live tests and quizzes. So in Unacademy, all these live tests, mock tests, quizzes are all provided, and and as a result, you can evaluate what is your strong area and your weak area. Fourthly, the subscription. So subscribing to the subscription gives you unlimited access to all the live and recorded classes, and you can watch these videos in the comfort of your home with your own laptop or your phone. Anyway, I would recommend this. Coming to the top educators, these are our top educators, and you can get access to all your classes through the subscription. All the subjects are available and are taught in the NEET PG and Academy courses. These are the ongoing courses in our platform. Coming to the NEET PG subscription, as you can see, the 12-month course, 12-month subscription is 25,000. And if you use my code SDUS, you get a 10% discount, and it comes to 22,500. Okay, so now here the 24-month, the 2-year subscription comes up to 30,000, and if you use my code SDUS, you get a 10% discount, and it comes up to 27,000. See, it's for your preparation, it's best to utilize this platform, and using it in the early part of your preparation comes a long way. Okay, and you can plan your entire year based on the classes available. So now coming to the topic proper, let us first discuss the definition. What is growth? Growth is the increase in size of organs and body. This occurs because of the multiplication of cells and increase in the intracellular substance. Basically this is a new since there is increase in the number of cells and the size of the cells, this is a quantitative parameter. Well, what is development? Sorry. What is development? So development is the differentiation and maturation of the function. As a result, there is acquisition of skills. So how does this differentiation, maturation occur? This becomes due to the myelination and the maturation of the nervous system. So optimal level of myelination leads to optimal development in the child. So this becomes the quantitative parameter. So growth is a development is a qualitative parameter. So growth is a quantitative parameter, while development is the qualitative parameter. So coming further on growth is a continuous process. So what does that mean? So growth happens, growth should be monitored from the time of being an ovum till the time you attain complete maturity. So complete maturity, that is physical maturation, is attained in girls at 18 years, while for boys it is 20 years. Okay, keep that in mind. Physical maturation for girls is 18 years and for boys is 20 years. Rate of growth. So the rate of growth is rapid in the first 2 years, which slows down between 3 to 10 years. And again, there is a spot. Again, there is a rapid growth. That is the growth spurt of puberty. Okay, so once the puberty is over, the growth slows down and comes to a halt. That is, it is zero in adulthood. Fine. So what are the principles of growth? So as I've said, it is a continuous process. So growth pattern is unique in every individual, and different tissues grow at different rates. So I will show in the next slide. So graph of the tissue growth. So you can see here. So the brain and the head and brain development or the brain growth happens in the first 2 years. So 80% of the growth of the brain happens in the first 2 years. So you can see there is a sudden hike and then there is a plateau. As likewise, when you see the lymphoid tissue, there's an increased sudden growth in between 10 to 12 years. Okay, there's a sudden peak. Likewise, the reproductive growth, there is a peak, there's a sudden spurt in growth after 12 years. So it corresponds to the puberty. Okay, then the general somatic growth is a slow growth, slow and regular growth, which you can see here. So different tissues have a different rate of growth. Okay, so how do you assess growth? What are the parameters that you check to assess growth? So in anthropometry, what comes? So in anthropometry, the weight, height, head circumference, chest circumference, mid-arm circumference, and the upper body lower body ratio comes. Okay, the sexual maturity rating comes in an adolescent. So when we study about adolescent medicine, then we'll discuss about the SMR, sexual maturity rating. Fine. Next comes the dental age, and thirdly the bone age. Okay, so first we'll discuss about weight. So there are various formulas to calculate the expected weight for different age groups. Okay, so first coming to the between 3 to 12 months. So the formula for 3 to 12 months is age in months plus 9 divided by 2. So if the child is 10-month old, it is 10 plus 9 by 2. So 19 by 2. That is around 9.5 kg. Okay, so that is the expected weight of a child who is 10-month old. Got it? Likewise, for a 1 to 6-year-old child, the expected weight is calculated by age in years into 2 plus 8. So if the child is 5-year-old, 5 into 2 is 10, 10 plus 8 is 18 kgs. So for a child who is 5-year-old, the expected weight is 18 kgs. So for a child who is 7 to 12 years, the expected weight is calculated by age in years into 7 minus 5 by 2. So if a child is 10-year-old, 10 into 7, that is 70. 70 minus 5, that is 65. 65 divided by 2, that is 32.5. So around 32 kgs. Okay. So another way, how up to 1 year, how do you calculate? So for a child who is at 6 months, the weight should double the birth weight. So if the child was 3 kgs at birth, at 6 months, the child should be 6 kgs. Okay. And similarly, for a child who is at 1 year, the birth weight should triple. So the same child who was 3 kgs at birth, at 1 year should be 9 kg. So 3 into 3. So I hope you got this right. Okay. So these are very simple. So now we can go. So 3 to 12 months, the expected weight is age in months plus 9 by 2. And for 1 to 6 years, age into 2, 18 years into 2 plus 8. While for a 7 to 12-year-old, it is age in years into 7 minus 5 divided by 2. Okay. And for a 6-month-old child, the birth weight doubles at 6 months. And for a 1-year-old child, the birth weight triples at 1 year. Okay. So height. So for height, a very important thing you need to know. See, for a child less than 2 years, it is the length. It's in the supine position. You measure the length of the child, because it's difficult to make a child less than 2 years stand and check. So the equipment to check the length of the child is called infantometer. Okay, so the height after 2 years, when the child can stand properly, then you use a stadiometer, and that is called height. So the height is the standing in the standing position, and while the length is in the supine sleeping position. Okay, so there's a formula to calculate the expected height also. So that is between 2 to 12 years. Okay, so for a child who's between 2 to 12 years, the expected height is calculated by age in years into 6 plus 77. Okay, so this is very simple. So just always remember, since height is a larger parameter, I mean larger is always in a larger number, so keep this mind, 77, 2 sevens. Okay, so another thing you have to keep in mind, how the normal average growth, what happens. So at birth, the average length of a child is 50 centimeters, and at 1 year it becomes 75 centimeters. So this you should keep in mind. A lot of questions do come from this. Okay, so 1 year it is 75 centimeters. At 2 years it is 87 centimeters, and at 4 years is 100 centimeters. So the length, which is 50 centimeters at birth, doubles at 4 years. So 15 to 2 is 100, right? So the average length of the child, which is 50 centimeters, doubles when the child is 4 years. So head circumference. So there's a formula for head circumference as well. So expected head circumference is based on the length of the child. So the length in centimeter plus 9.5 divided by 2. Okay, so there can be a variation of plus or minus 2.5. Keep that in mind. So there is a pattern also. How do you know? How does the increase in head circumference happen? So in the first 3 months of life, the head circumference increases by 2 centimeter every month. 2 centimeter. So divided into first 3 months, 3 to 6 months, and 6 to 12 months. So the first 3 months it is 2 centimeters every month. The next 3 months, that is 3 to 6 months, is 1 centimeter every month. And the next last 6 months, that is 6 months to 12 months, it is 0.5 centimeters every month. So keep this in mind. Okay. Again, so a child is born with the head circumference between 33 to 35 centimeters. That's the normal head circumference. So below that is microcephaly, and above that is macrocephaly. Okay, so head circumference between 33 to 35 centimeter at birth. So at if the child is around 34 centimeters, at 3 months it becomes 40 centimeters, right? Because 2 centimeters every month, so increase in 6 centimeters. So if it is 34 plus 6 becomes 40 centimeters. Then 3 to 6 months is 1 centimeters every month. So it comes up to 43 centimeters. Right? Then from 6 months to 12 months it is 0.5 centimeters. 0.5 centimeters every month. So that is again 3 centimeters. So 43 plus 3 is 46. So we should remember this. And at 12 years, the head circumference is 52 centimeters. Okay, keep that in mind. So chest circumference. So at birth, the head circumference is greater than the chest circumference. When does the head circumference chest circumference equalize? That is at 1 year. So head circumference equalizes with the chest circumference. So after that, the chest circumference becomes greater than the head circumference always. Okay. Now mid-arm circumference. So when child is born with the mid-arm circumference of 9 to 11 centimeters. And by 1 year, it goes up to 17 centimeters. From 1 year to 5 years, there is the mid-arm circumference is constant. Okay. So again, this is very important for your malnutrition. How do you, what are the features in severe acute malnutrition? So this we will discuss later, but you need to know what is normal. So right now we are discussing the normal things, normal growth and development. Okay. Upper segment and lower segment ratio. So when a child is born with with the ratio of 1.7:1. When does the upper segment and lower segment ratio equalize? It equalizes between 8 to 10 years, that is 1:1. By the time the child is 18 years, the upper segment becomes shorter than the lower segment. So 0.9:1. Okay, keep that in mind. Dental age. So deciduous teeth, that is the milk teeth, okay, that first develops between 6 months to 2 years, and permanent teeth erupts from 6 years to 13 years. So again, the importance of this is, so if there are sometimes cases where there is delayed eruption of tooth, okay. So delayed eruption of tooth helps us to find out certain conditions like hypothyroidism, rickets, and so on. But delayed eruption can also happen in familial causes, familial conditions, genetic causes, and idiopathic causes. So all this helps us to find out what are the abnormalities. Bone age. So bone age is based on the time of appearance of ossification centers. So different bones have different time of appearance of the ossification centers. So if bone age is more than the chronological age, it is advanced. So remember, bone age being more means advanced bone age. So bone age less than chronological age is delayed bone age. So again, assessment of bone age is very important, especially to evaluate a child with short stature. Okay. Now, how do you predict adult height? So this is another thing we need to know. They might give you a growth chart and they might tell project, and they might show a projection and tell you if the height of the child is normal or abnormal. Okay. So for now, since we are you need to know how the basics. So we are teaching the basics right now. Next week, in the next discussion, maybe next class, I can discuss about short stature. So that time I will discuss in more detail about how to point the mid-parental height in the chart. So how do we predict the adult height? So adult height is predicted by the mid-parental height. Okay, for boys it is father's height in centimeters plus mother's height in centimeter plus 13. Remember, for boys it is plus 13 divided by 2, and for girls it is father's height plus mother's height minus 13 divided by 2. Okay, so the 13 is basically the average difference between a man and woman. Okay, and each of this can have a variation of plus or minus 6. So father's height plus mother's height plus 13 divided by 2 plus or minus 6, and for girls it is father's height plus mother's height minus 13 by 2 plus or minus 6. Okay, now coming to development. First main thing, we need to know principles of development. Again, this is a very important question. You need to know, you shouldn't be forgetting principles of development. You can either get a question as what is false in this, what is true in this. Okay, so you need to know all the principles. Okay, so firstly, development is a continuous process. Second, I have already discussed about this already. Depends on the functional maturation of the nervous system. Okay. Thirdly, the sequence of attainment of milestone is same in all children. So that, what does that mean? So neck control should happen between 3 to 4 months, and then child sits without support somewhere around 6 to 7 months, and then stands by 1 year. So the child directly cannot sit. Okay, the first should be a neck control, then sits, and then stands. So that is a sequence what they're saying. So the process is in cephalocaudal direction and proximo-distal. So what does cephalocaudal mean? First there is neck control, then there is trunk control, then there is limb control. That means cephalocaudal from head to toe. Got it? Okay. What does proximo-distal mean? So that means what? The development wise, first the function of the hand comes, then the function of the fingers comes. So just like this. So proximal comes first and then comes the distal function. Okay, so remember, cephalocaudal and proximo-distal. Okay. Primitive reflexes should be lost before the corresponding voluntary movement is acquired. So primitive reflexes are there for a very short time. Okay, so the persistence of primitive reflex again is a point of a developmental delay. So always the primitive reflex should be lost, and that corresponding voluntary movement is acquired once the primitive reflex is lost. Next, Disorganized mass activity is replaced by specific action. What does that mean? So if you give a toy to a small baby, of maybe a 10-month-old baby will be very excited, happy, tries to get the hands together and take the toy and all that. So there is a disorganized mass activity. But while if you give the same toy to a 3 or 4 year old child, the child will smile and take the toy. So that is called a specific action. Okay. Now coming to developmental milestones. So here I've made a chart. Okay, so it might be a little confusing right now, but I am going to repeatedly discuss this topic again and again, maybe in the revision tests or end of certain classes, so that it becomes easy for you all to remember again and again. I mean, because this is a you end up forgetting. So for now, what I want you all to keep in mind is, remember 3 months, 6 months, 9 months, 12 months, 15, 18, and 2. So these are all multiples of 3. 3, 6, 9, 12, 15, and 18. Okay. So these are the important. Then in between you can just remember later. So I will slowly ask. Okay. So 3 months in the motor milestone, it is neck control. Simultaneously, there is bidextrous grasp, the recognition of mother, and there is cooing. At 6 months, child sits with support in a tripod fashion. Then there is unidextrous reach. There's stranger's anxiety. Then there is monosyllables. Baby can use means they start saying monosyllables, ba, ba, da. Okay. In the 9th month, child stands with support. Okay. Immature grasp, immature pincer grasp. Okay. Waves bye bye. 5 syllables. You'll remember. Don't worry. Don't feel it. I'm going far. This is one topic which is very volatile, but we will do this again and again and again and again so that you can remember. Okay. We'll make it easy. Okay. 12 months. Stands with support. Child stands with support. Mature pincer grasp. Comes when called. 1 to 2 words with meaning. Okay. At 15 months, walks without support, imitates scribbling. See, it doesn't scribble, it just imitates. See, already pincer grasp has come. Baby tries to imitate scribbling. There's jargon. At 1.5 years, that is 18 months, child runs, scribbles. Now the child scribbles. And now you remember, in the 1.5 month, that is 18 months, a 1.5 year, that's 18 months, the tar starts happening. When the child scribbles, you remember tower, baby, child starts playing with blocks. So first is Tower of 3. Copies parents' task, 8 to 10 word vocabulary. At 2 years, child climbs stairs, 2 feet per step. Then there is Tower of 6. Again, always remember multiply by 3. Even this I've told 3, 6, 9, 12, 15, and 18. Like that only even for the block. 3, 6, 9. So after 1.5 years, it is 3 blocks. Then at 2 years, it is 6 blocks. Child asks for food, drink, and asks to go to toilet. Shows toys. 2 to 3 word sentence. Uses me, I, you. At 3 years, writes tricycle. This is very simple. 3 and try. Writes tricycle. Okay. Now, at 3 years, Tower of 3. Correct? 3 into 3. Tower of 3. Copies a circle. So once the tower of 9 comes, there's a circle happening. Circle. Shares toys. Asks questions. 4 years, child hops. Copies a cross. Now, all the tower of blocks is done. So now what? The child does a bridge of blocks. Plays in a group, goes to a toilet alone, says songs, tells stories. At 5 years, child copies a triangle. Now, from the bridge, the child can make a gate with blocks. These are all very important. You have to remember all the shapes with age. You need to remember the blocks. What does the child do with the blocks? These are all very important things. And resting and unresting, this is very important. Okay, this comes in social milestone. For language, the child asks meaning of words. Okay, so now you've known what is the normal developmental milestone. So why is it necessary? So we need to know the developmental milestone so that if they are delayed, we can work up why is the delay happening. Okay, so what is delay? How much is delay? You need to know that. Okay, so first, if neck control is not attained by 5 months, that's a delay. If the child is not sitting without support by 9 months, that's a delay. If the child is not walking without support, okay, walking freely by 1.5 year, 18 months, that's it delay. So this you need to keep in mind. What are the warning signs? Okay. So again here, what is true, what is false might come. So to keep in mind. So this looks very confusing. That's why development milestones is important. So either they can ask direct questions or they can ask, roundabout, like, here they might show five developmental milestones and they might ask what is false, what is true. So that gets a little confusing. So that is why we need to become very paka. So that's the reason I will start once in 3-4 classes. I will keep asking you something or the other about developmental milestones so that you all remember. So developmental assessment. Now development quotient. Okay. So one of the uh, things where you assess development of child is development quotient. This is done at the end of developmental history always. Okay. So developmental quotient is the development age of the child. So if the child is delayed, if a 3-year-old child has developmental milestones of a 2-year-old child, then the development becomes 2 years and the chronological age becomes 3 years into 100. Okay, so that's how you do. So if the developmental quotient is 85 and above, it is normal. Okay, if the development quotient is between 71 and 84, it becomes mild to moderate delay. And 70 and below 70, it becomes severe delay. So now what are the screening tests? So there is Denver development screening test. Okay, so over here there is they screen the test for the developmental delay, and there is Phatak Baroda's screening test. This Phatak Baroda screening test is the one best used in India, and Dr. Pramila Phatak developed this in India. Okay. Here there are a lot of tools to screen the child for the developmental assessment. Development screening is done with a lot of other tools, and good enough Harris drawing test. So remember drawing test. So over here the child is made to draw a man, and based on each detail what the child adds to the drawing, points are given. Okay, based on the details. So that is how you can screen the child for the development delay. Okay, good enough. So Denver development screen. So these are all screening tests. Okay, not definitive conformative tests. So Denver development screening test, Phatak's Baroda screening test, good enough Harris Harris drawing test. So developmental scales for definitive testing. Bailey scale of infant development. Over here, uh, the gross motor, all the 4 domains are assessed, and standard Binet intelligence scale. Okay, this scale is mainly where you can calculate the intelligence quotient, and this is done in people up to 80 years. Okay, so remember this is mainly for intelligence intelligence quotient. Okay, and next is the Wechsler intelligence scale for children. Over here, along with the intelligence quotient, they also assess the other 4 domains, that is gross motor, fine motor, language, and all the other domains are also assessed. Okay. So I hope you have understood most everything about growth and development. If you have any doubts, please do ask. I will clear your doubts. And my next topic for discussion will be growth. That is abnormalities of growth. So mainly short stature and all the syndromes associated with. I would want to discuss about the growth charts as well. So I again tell you, use my code STUS and get a 10% discount on the subscription. And bye for now. Good luck.